Welcome to You and Your Health. I'm Dr. David James. Today's topic of discussion is oral health as it relates to our total general health. Our guest today is Dr. Joseph Schachner. We all go to the dentist, usually when we get a reminder notice, and have our teeth checked and cleaned for a lovely smile. However, what we're not aware of is the importance of a healthy mouth to our general health. Dr. Schachner had practiced dentistry in New York City for 45 years. He has had a very interesting career. Among his many accomplishments, he was past president of the New York County Dental Association and the Bronx County Dental Society, as well as other positions in the dental community. He was also past chair of the New York Dental Meeting, which is the largest dental meeting in the country, in the United States, counting more than 58,000 attendees every year. Dr. Schachner, what can you tell us about the benefits of a regular dental exam?
Well, the typical dental examination that most people think about is going to the dentist on a semi-annual basis or sometimes 3 times a year and have their teeth checked. They're looking for cavities or they're looking for bleeding gums. And yet that is basically what has always been thought of as doing dentistry. We used to have a cliche that said, drill, fill, and bill. That's not the way it's done today, or should not be done that way. There's no doubt that the teeth are important to preserve, and that is one of the major roles of the dentist. However, the most important part of going to the dentist would be a complete oral and facial examination. There are many diseases and situations that are reflected in the mouth. If you recall that old adage that we all know, those of us in the healthcare profession, the mouth is always considered the mirror of the body. And so when one goes to the dentist, one should have his face, the internal portion of the mouth, examined. For example, the inside of one's cheeks, the tongue, the sides of the tongue, the floor of the mouth, the hard and the soft palate. Many today have been giving up on smoking, but it was not uncommon in smokers. When one looks on the inside of their cheek, they would see a milky white discoloration. It was called leukoedema today, and it could lead to leukoplakia, which has been shown to be a forerunner of oral cancer. Many of our younger people today who want to emulate their heroes in baseball have chosen not to go with tobacco, but go with smokeless tobacco. And in that case, they're chewing that or tucking it into their cheek, and I guess that gives them a macho feeling. And as a result, there has been an increase in lip cancer and floor of the mouth cancer. So that's just one item that one looks for in the way of cancer. Other areas, when one examines the face, one could see diseases such as lupus. They'll get a butterfly appearance on the sides of the nose, and that's just an indication that that is going on. Another area is Sjogren Syndrome. Sjogren Syndrome is a dryness of the mouth, which is an autoimmune disease, and can affect the pancreas, the lungs, the GI, gives someone a feeling of almost depression and sort of laziness and not feeling up to par. Sjogren Syndrome can be treated by using a toothpaste and mouthwash that could bring some moisture to the mouth, and as a result, these people can enjoy foods again, enjoy the taste of some foods which they've lost due to the Sjogren Syndrome. I just want to not deviate, but talk about something that I'm very excited about. When one looks for a malignancy in one's mouth, they look for lumps and bumps and red, white, and blue lesions. And it's usually at that point in stage 2 or 3 of cancer. And unfortunately, the cure rate, a 5-year cure rate, is only about 34% when found in stage 2 or 3. When found in stage 1, there's almost an 85% cure rate, and that's a big difference. However, only 34% of the patients who go to dentists ever have a thorough clinical exam. What I'm excited about is there's a new area called Salivary Diagnostics, where one can take a bit of the patient's saliva, send it to a laboratory, and within 3 days they'll have a result. Now, there are no lesions present, nothing that would even be suspicious. And this test will come back and indicate if there are markers in the DNA which could indicate that oral cancer is a probability. Studies have been done for the last 5 years at UCLA, University of Pennsylvania, and Penn State. The results of the tests they've been doing for the last 5 years have been with 95% accuracy.
This is fascinating that...
So that's something I think the earlier we find a disease and the earlier we can treat a disease, the higher the results are for a cure or sufficient treatment.
This is great. This is going forward.
Yes.
Today, we go over to the dentist's office, we sit down on the chair, and the first thing we know is that we have a cone coming and saying, you're going to get a full mouth x-ray.
That's correct.
Now tell me a little bit about how safe are all the x-rays, especially if you get them on a regular basis, directly to the gums and directly to the bone.
Well, to tell you the truth, I'm glad that we're talking about this in this community, because this community is a golfing community. Today, the x-rays that are taken by most dentists, and I would say 80% of the dentists who are out there, are done with digital x-rays, no longer film. And the digital x-ray will give you 40% less whole body radiation. In fact, a full mouth set of x-rays is equivalent to you going out and playing 18 holes of golf on a sunny day. So I don't know which one is preferable. Some people hate to play golf or don't do as well, or would they rather be sitting in the dentist's chair?
Well, I don't think it's very much of it.
And as we go forward even more, we have a 3-dimensional type of x-ray, which is on the rise. There has been some controversy a few years ago when the New York Times wrote a scathing article about it, but it was full of loopholes. It's called cone beam technology, and that can give you a 3-dimensional picture of one's jaw, and is most useful when having implants done. And the cone beam, you can take off another 40% for whole body radiation. So x-rays have become quite safe, and if one were to look at a risk and reward, your x-rays will divulge any tumors or cysts in the jaw. There's one, it's not that common, but there's a cyst at the angle of the jaw called a mieloblastoma, and that will grow to where I've seen them huge, to where actually a fracture of the jaw can occur because the bone has been totally eroded. So x-rays are important. Not only will it divulge cavities, not only will it divulge gum disease, which is a misnomer in itself, because gum disease is a disease of the bone. The gums get reddened, they get inflamed, they bleed on touch, but it's really the supporting bone that's moving away. And it's also a common, there are 2 common things that can occur when one has swollen and puffy gums. One, which doesn't apply too much to our community, and that would be pregnancy gingivitis, although we have children and grandchildren, so there is something there. And also diabetes. Patients who have diabetes will very often have swollen gums, will also have redness and bleeding, and this too will have them lose bone. And as a result, many people with uncontrolled diabetes will wind up losing teeth.
So you can tell a lot by a thorough examination
Absolutely.
of the mouth cavity.
Yes.
Now, what would you suggest or what would you advise us as a more senior community? What do you think we should all be aware of and follow through on a regular basis?
Well, first of all, I think that most people should visit the dentist twice a year, and in some occasions 3 times a year. The older population today, approximately 75% of them have periodontal disease. And if it goes unchecked, you will lose teeth. You will also lose bone structure. So it's important to have your teeth cleaned and to be done properly and have the plaque removed. In fact, there was an interesting article and an interesting discovery made approximately 20 to 25 years ago, where they said the incidence of plaque, that's as people call it, tartar, around one's teeth, if there's an excess, there has been a definite link to that and coronary artery disease. So there's another area of helping yourself by going to the dentist, and by just seeing a lot of plaque on one's teeth doesn't mean they're going to have or have a coronary artery disease, but it can be indicative, and I think will help other parts and allow us to enjoy the blessings of BallenIsles and enjoy all the activities that go on here.
Well, Dr. Schachner, unfortunately our time is running out, and I'd better get to the phone and make an appointment because I know my dental exam is a little delayed. We have all had a much better understanding as to why we need to have our regular dental checkups, and we thank you for sharing with us this valuable information. And thank you all for watching, you and your health.
Thank you, David, and I thank you for inviting me and allowing me to talk about my experiences in dentistry.
Pleasure.